It was my privilege to be part of the Isha research team, and we did two major projects, one with the 4-day program and the other one with the 8-day retreat. And with the 4-day the retreat, what we saw was a significant reduction in depression and significant reduction in anxiety levels of the meditators and
Oh, maybe that's the reason I've never been depressed.
Yeah, that's good to hear, Sadhguru. Even yesterday, I was in the operating room and we had a COVID patient, and there was so much fear and anxiety even among the physicians. And it takes a special person to have that kind of courage to take care of these patients. I think the meditation helps many people. So another finding we found was we not only looked at the psychological well-being of the meditators, we also wanted to show objectively why they feel good and how they have lower levels of depression, how they have higher levels of focus. So what we did was we measured blood levels of anandamide, which is an endocannabinoid. And anand is bliss or in Sanskrit. So what we showed was in about 140 patients, not patients, it's meditators, before and after, we saw 70% increase in anandamide and other endocannabinoids. And also, we saw a significant 70% increase in BDNF, which is a brain-derived neurotropic growth.
I won't let you test my blood, then you will think I'm smoking something.
That's a good thing. I think we don't need any pharmacological influence. In these pandemic times, we have so many, even physicians, depending on alcohol and drugs, marijuana, we have our body's marijuana, which is an anandamide or endocannabinoid, and we can have it whenever we need without any expense or side effects. So I think all the meditators who participated in the BSP or the 4-day program had that. It doesn't need a lot. All they needed to do was be part of that retreat, and they immediately got it. And not only that, it persisted beyond the 4 days. We followed all these participants up to a month, and they had persistent lower levels of depression and anxiety, and also positive well-being, psychological well-being. That was the finding. And the other study we did was with the 8-day program. We saw even bigger effect size in terms of 50% reduction in depression and anxiety. Some of our the participants had depression at almost 10%. Their scores went down significantly down after the program. And we followed these participants up to 3 months. We saw significant reduction, persistent reduction beyond the 8-day program up to 3 months. We also measured their systemic inflammation over time, over 6 months period, compared to the household, their own husbands and wives at home. Their stress level and systemic inflammation level of the meditator was 2 to 3-fold lower. And that was a significant finding we observed. And also we showed other health benefits, including better lipid profile, better hemoglobin A1C, which is related to diabetes, was a lot better in all these participants. And also we, with the collaboration with another meditator, Vijay Chandran from Florida, he was able to show, related to the COVID situation, the meditators, the gene signature improved, and in terms of it activated immune pathways, specific pathways and genes over time. Just 2 months after the meditation, it had significant activation, and in terms of protecting them from infections like COVID.
Senthil, thank you so much for that brief description. And hopefully all these papers will come out. We know that we have almost half of them in. So it seems to me that they have very low levels of C-reactive protein. That means low level of inflammation. They're also having good levels of lipids. They have good levels of hemoglobin A1C. And you're also talking about activation of immune pathways by genetics. So to summarize, right? So Swami, you were nephrology expert and also the researcher in the immunology world, how do you think if a meditator, any kind of meditator, actually is well prepared for facing this COVID situation? Can you tie this all up?
Right, yeah. Thank you, Bala, and Namaskaram, Sadhguru,
Namaskaram.
for the great opportunity and to be a part of this enlightened panel. So, first I want to start with, what COVID does to the body. So the virus, initially there is an infectivity of the virus, and then the virus enters the cell through a certain receptor. And once within the body, what it does is that there are certain immune responses. These are called as virus restriction factors. So one of them is called interferon. If you have sufficient amount of those viral restriction factors or immune responses, what it does is that the host or the human body is able to limit or prevent the virus from infecting. Now, the second phase is that, let's say that the virus eventually is successful in infecting the body, then how do you handle that infection is the second phase of the COVID-19 infection. So there are certain responses that happens. One of them is called as uncontrolled inflammation. It's also called as cytokine storm. And the other thing that happens as a consequence of all this is that there is damage to the lung and the amount of oxygen in the blood is low, which is called hypoxia. And then once these patients are hypoxic, then they get treated and then they get a supply of oxygen back. Now they are not able to handle that oxygen being given back. It's called reoxygenation. And then that causes more damage to the body. Mm-hmm. And the third thing that happens to the body is that because of the excess inflammation and the hypoxia and hypoxia reoxygenation, which is happening in these patients, there is damage to the blood vessels, the cells that line the blood vessels, and results in excess clotting. So one of the things which people are seeing is that patients who got COVID-19, they got very high incidence of what is called as thromboembolism, which is nothing but excessive stickiness of the blood or clotting, which is causing them to have organ dysfunction and causing them to die. So this, in summary, kind of summarizes excess inflammation, excess clotting, and low oxygen and inability to handle that, which is causing this COVID-19 to really kill a lot of people around the world. So now going back to meditation, what happens during meditation?
Can I ask you one question in between?
Sadhguru.
See, if body is reacting to reoxygenation, so what is the standard protocol that all of you are following for this COVID when somebody comes to hospital in a certain, let's say, reasonably serious condition? If oxygenation is not the thing to do, what do you do?
Right. I mean, that's a difficult thing to treat after the disease is set in, Sadhguru. Because once there is hypoxia, and then hypoxia itself is harmful to the body, then you have to correct the hypoxia, then reoxygenation is bound to happen. And as of now, we still don't have a complete understanding or have any therapy to really prevent this cascade of events. So you are forced to treat the hypoxia, but you don't have a way to really prevent this reoxygenation injury from happening. But from previous studies, we know that there are many interventions that can actually limit the reoxygenation injury while we correct the hypoxia. And one of the key pathways that is relevant in preventing this reoxygenation injury is antioxidant responses. So if your innate ability to deal with oxidative stress, otherwise it's called free radicals, and there are mechanisms in the body to deal with the free radicals. If those responses are empowered by any mechanism, whether it is through drug or whether it is through eating or whether it is through meditation, then your ability to handle that reoxygenation induced free radical damage may be more effective. And there are other things people have tried, vitamin C or vitamin E and all kind of chemical strategies which can also be used to limit the reoxygenation injury. Mm-hmm. But I want to add one more thing, Sadhguru, which could be really interesting. And what the studies have shown is that people who do proper yogic and meditation practices, and at least in one study, they have looked at and shown that glutathione, which is a critical molecule to prevent free radical injury within the cell, the levels of it is significantly increased days or weeks after they start this practice. So definitely in terms of preventing the free radical injury or reoxygenation injury, the meditation and yogic practices do really help.
So one of the things, Swami, is I just wanted to add, which is obvious, I think you know it, but just for the viewers' purposes, that you just give enough oxygen that is required to keep their oxygenation levels sufficient, right? Suppose in hypoxia, you don't give 100% oxygen. Just give as much as required to keep it at 94%. Okay, go ahead.
Exactly, yeah, because hypoxia, having a low oxygen itself is harmful to the body, right? And so you have to correct the hypoxia, but you have to empower the body to handle the free radical that is going to come from reoxygenation. So that's one aspect of it. Now, going back to the whole aspect of what happens with the meditation, and a little bit I'll touch on samyama also, what we know from preliminary data, is that the first thing that these practices seem to do, what Sandil alluded and Vijay has generated data, is that it is activating the genes which are critical for restricting the coronavirus from infecting the cell. How do we know that? We have samples on samyama volunteers before they started the practice, and then at 48 hours after they did the practice, and then at 3 months after. And when we went and looked at thousands of gene signatures, and then it turns out the set of genes which are linked to this viral restriction, otherwise the interferon pathway, seem to be directly activated in people who are doing samyama. So this data is really, really exciting.
So you mean the 8-day meditation retreat, right? Swami, sorry to interrupt. So just a 8-day meditation.
8-day meditation retreat, exactly. And so in fact, one of the articles we referred is that there is one particular paper where they showed when they take the SARS-CoV virus 2 and infect what are called organoids, they are trying to create a model like what happens in human. The set of genes that are activated by the SARS coronavirus and organoids, that is the protection which the body is trying to do, are the same genes that are getting activated in the samyama participants at 2 or 3 days after they started this practice. The second set of things which is really interesting and useful also is that at 3 months after they finish this 7-day program, the antioxidant response genes are the ones which are most potently activated in their body. So not only we are having the viral restriction or balanced immune response, but also the protective response for the cells are also getting activated in this practitioners of this. So this, and there are previous studies in other meditators also, people have published, and again really showing that ability to handle a viral infection is specifically those pathways are activated in people who are doing practice of meditation and yoga.
Thank you.
Thank you, Senthil and Swami.
Thank you very much.